Thanks to all for joining us today's webinar. Myself, Dr. Vandana Bukade, Professor at Srimati Urmila Devi Ayurvedic College, Hoshiarpur, Punjab. I welcome you all to the National Webinar Series Ayush Vibhodhini Part 2, organized by our college. First of all, I thanks to Honorable Chairman of our college, Engineer Amarjit Singh Walia sir, for taking such an initiative. I welcome to college principal Dr. Meenakshi Nath Madam and Vice Principal Dr. Mrudu Sharma Madam. I am also thankful to coordinator committee of the session, Dr. Deepika Minas, Dr. Sonika Madam, Dr. Pooja Thakur Madam, Dr. Jyotika Madam. Now I request to respected Vice Principal Madam Mrudu Sharma Madam to share few words of the wisdom. Over to you, Madam.
Thank you, ma'am. Good morning, everyone. Myself, Dr. Mridu Sharma, and I'm working as Vice Principal in Srimati Urmila Devi Ayurvedic College. I welcome you all on the today's session of Ayush Vibhodhini. This series is a great initiative by the support and guidance of our Chairman, Engineer Amarjit Singh Walia, and Principal Dr. Meenakshi Nath. I also extend my thanks and appreciation to our worthy coordinators, Dr. Deepika Minhas, Dr. Pooja Thakur, Dr. Sonika Jarayal, and Dr. Jyoti Saroa. Now, I would like to welcome and thank Dr. Krishna Thorat for sparing her valuable time for us. She is a great academician and a motivational speaker. She has clear vision about what she wants to do, and she is working miraculously in the upliftment of Ayurveda through the awareness among youth and public. Thank you, Dr. Krishna, for being a part of this series. This means a lot. I'm sure we will be benefited by your immense knowledge. Thank you and welcome. Over to you, ma'am.
Thank you, Madam. Now I welcome to our today's speaker, Dr. Krishna Thorat Madam, MD, PhD. I would like to introduce her. She is Associate Professor in Rog Nidan एवं विकृति विज्ञान, Parul Institute of Ayurveda, Vadodara, Gujarat. She has completed PhD from Parul University 2018 to 2021. She has completed MD in Rog Nidan in 2014 from MUHS Nashik, Maharashtra, LRP Ayurved Medical College, Islampur. She has completed BAMS from RGUHS SDMT, Ayurved Medical College, Terada. She has written and published more than 22 journal articles. She has also presented 7 papers and 2 posters in seminars and conference. Poster's name is Application of Jaloka in Thrombus Piles. Basti versus Hydrotherapy in Mutrashmari. She has published one book. Book name is Heal Hemorrhoids Through Ayurveda, bestseller on Amazon in medical category. She has academic achievements. She is secured in second position for Best Presentation Award in Sammohan 2019 National Seminar in Parul University. She is secured first position for Best Paper Presentation Award in Ayur Gaveshna 2021. Recent Advance in Ayurveda International Webinar organized by NKJMC Bidar, Karnataka 2021. She secured first position for the Best Paper Presentation Award in Stanya Amrut 2021 National Seminar in Parul University. She has received Madhavkara Puraskara from Gujarat Board of Ayurvedic and Unani System of Medicine on the occasion of International Conference on Genetic Disease, Care and Cure 2021, organized by Faculty of Ayurveda, Parul University. Life membership of Rog Nidan Vikruti Vignan, PG Association for Pathology and Radio Diagnosis from 2021. She has delivered lecture on clinical interpretation on blood indices as a guest speaker in national webinar clinical aspect of रोग निदान एवं विकृति विज्ञान in September 2021, organized by AVM AMC Satara, Maharashtra. She has delivered lecture on morphological abnormalities of red blood cell as guest speaker in PhD webinar organized by Faculty of Ayurveda, Parul University, December 2021. She has delivered speech on critical analysis of Shat Kriyakal in Pandu with special reference to Nidan Panchak, a resource person in national webinar Nidan Siddhi in 2022, organized by SBC Ayurvedic Medical College and Hospital, Belgavi, Karnataka. She is very good sportsman and singer. Kabaddi national player in GNV Samiti 2002. She secured second position in shot put and discus throw in 2019 Parul University. She secured second position in singing competition 2021 in Parul University. More than 7 motivational speech given to students and faculties on how to get rid from negative emotions and bad habits. Secret of growth techniques for how to concentrate etc. Marathi blog writer on blog मनातल्या गोष्टी. More than 20 workout groups on WhatsApp. Motivation for the physical and mind health. She is also so many responsibilities in NABH, NAEC, exam cell in Parul Institute of Ayurveda and Research. Today, without taking more time, we will start the today's session. Today's topic is critical analysis of erythrocytes indices in various diseases. We are waiting for a wonderful and interesting session. Over to you, madam. Dr. Krishna, madam.
Thank you so much, ma'am, for your warm welcome. Thank you so much. Before going to the presentation, I would like to, my voice is clear, ma'am?
Yeah, clear, madam. Clear, madam.
Yes, madam, yes. Before going to the presentation, I would like to say thanks to Amarjit Singh Walia, chairman of Urmila Devi Ayurvedic College of Medical Science and Hospital, Hoshiarpur. Even I would like to thanks to Dr. Meenakshi Nath, principal, and even though my good friend Dr. Mridu Sharma, I would like to thank her also, vice principal of Urmila Devi Ayurvedic Medical College and Hospital, Hoshiarpura. Thank you so much for giving me this opportunity. Thank you. Can I share my slide, ma'am?
Yes, madam.
Yeah. Okay, ma'am. Slide is visible, ma'am?
Yes, madam. Visible.
Yes, okay, ma'am. I started my slideshow, ma'am. Whether it is visible clearly?
Clearly visible, madam.
Okay. Shall I start, ma'am?
Yeah, sure. Yes, madam.
First of all, I would like to again thanks to whole team of Urmila Ayurvedic Medical College, Hoshiarpur, along with all the students and guests, other guests, those who are present here. So I would like to thanks all of you and welcome. Hope my today's session will help you a lot, and it will also helpful in the clinical practice also. Those who are going to open their clinic in future. So many of times it will be happen. We missed some small contents which is available in our classics, along with if any investigation, if when we advise to the patient and when it comes to us. So it sometimes it will be missed from our side also to see all the investigations, to see all the parameters, and with the help of that we can diagnose many diseases. So my today's topic is only on the basis of that. So here I have introduced myself. I have Madam Vandana Madam has introduced me as very nicely, so there is no need to introduce again. But here I mentioned my email ID and mobile number. If anyone has any doubt or any new concept regarding my new topic, they can contact with me with the help of this email ID and mobile number. So my today's topic is a critical analysis of erythrocyte indices in various diseases. So, if you see why I choose this particular topic, madam, I am audible clearly?
Yes, madam, audible.
If there is any disturbance, kindly notice me, okay, ma'am?
Hello.
Yes, if there is any disturbance in voice, kindly notify me, okay, ma'am?
Okay, Doctor.
Yes, madam.
Yes, okay. Yeah. So, today's topic is a critical analysis of erythrocyte indices in various diseases. So, what is exactly reason behind this? See, if you get, obviously, if you when patient come to us, when we take all the history of a patient, and we can do on the basis of their signs and symptoms, we always do the provisional diagnosis of that particular disease. Okay, and after that, we take the help of some investigation. If a patient has come to us with the complaints of anemia, otherwise in our science we called it is a Pandu Rog. Okay, if patient comes with that signs and symptoms, and we analyze all the signs and symptoms, we analyze sometimes the which type of anemia is there, which type of Pandu Rog is there on the basis of their signs and symptoms. But for confirmation, we advise some investigation. For example, simple investigation is a CBC, that is a complete blood count is there. So with the help of a complete blood count, when the investigation come to us, what we exactly seen in that report. So most probably, while the diagnosis of anemia, most probably only we are concentrate on the hemoglobin. Okay, but if you want to fulfill the what you call definition of anemia, we have to concentrate on hemoglobin as well as the PCV, that is the packed cell volume, and along with that we have to concentrate on the RBC count. Okay, and with the help of that we can exactly diagnose whether patient is suffer from anemia or not. But in the practice, it is most probably we neglected. We cannot concentrate on what you call PCV along with RBC. We just concentrate on the hemoglobin. That means we are seeing that is a quantitative analysis of disease. That is a quantitative analysis of anemia. But what is the quality of a blood that we missed? Isn't it? But it should not be happen. We have to also concentrate on the quality of a blood, so that will be helpful with the help of these erythrocyte indices. Isn't it? That's why I choose this topic. It is very important. And when I studied on this topic, actually it is my PhD topic. I used these erythrocyte indices for the diagnosis of a Pandu. When I touch this topic, when I select this topic, I thought that this is a very small topic and I will do very fast work in that. But when I study all this topic, this is a very vast topic and it is very interesting topic. So hope this today's topic will help you a lot. So next, if you see the some times in our clinic, the patient will come with these symptoms. First of all, I would like to share one case. The patient having symptoms like giddiness, chest pain is there. Sometimes patient has a palpitation. Sometimes patient has a muscular pain. Whole body ache is there. Dyspnea is there. That means there is a difficulty in the breathing is there, and tingling sensation is there in hand or. So what happened? But along with that, patient also has the associated complaints like Ma'am, slide is moving.
नहीं मैडम, स्लाइड नॉट
Slide नहीं
मूव नहीं हो रही मैडम.
मूव नहीं हो रहा है. एक मिनट. हाँ, just
फर्स्ट स्लाइड ही शो हो रही है अभी.
Dr. Krishna, kindly turn off the slideshow and move the slide just on the basic page of PPT.
I've already done that. I already started my slideshow, but I don't know why it is.
Just close the slideshow. The slideshow is not visible on Teams.
Okay, I will try it again now.
Just move it on the normal PPT section. It will move there.
I will try to share it again. Okay.
Okay, madam.
Yeah.
Now it is moving.
Now it is moving?
Yes, it is moving.
Okay.
Yes.
Okay. Yeah. Now it is seen clearly. Now I have shared from my mobile because it is difficult from laptop. Now it is clear.
Yes. Yeah, it is clear now.
Yes.
Yes. Okay. Yes. Okay. So when patient comes to us with the symptoms of giddiness, with the along with that chest pain is there. Sometimes there is a palpitation is there. Sometimes patient has dyspnea, and along with that tingling sensation is there. But along with that, the patient also has associated symptoms like headache is there, severe body ache is there, generalized weakness is there, constipation history is there. Along with that, there is a repeatedly mouth ulcers are there. And along with that, patient also has brittle hairs and nails also. Okay? But what happens? We are always neglected these associated complaints. Why? Because these all symptoms are not actively, otherwise, what you call, these are not hampered our daily activities. But once it is shifted to the cardiac related symptoms, then we worry about that. When we thought that I have to visit to the hospital, I have to take care of my health. So we thought like this. But along with that, there is a in Ayurveda we call this, that is a Praktatma Lakshan, that is a paleness of skin, that is a Panduta can be observed into the patient. That is a paleness of skin, but in case of the female, it can be, we can assess that we are looking the pale, we are looking fair. Most of the female feels like that I am looking fair, but it is may be related to the some other condition, some medical condition that we always neglected. But with the help of this all knowledge, we can diagnose which particular disease is there. Now coming to the main topic, that is erythrocyte indices. We can call this other synonyms are there. That is erythrocyte indices. That is we can call that is the red blood cell indices. Otherwise there is erythrocyte indices also is there. Otherwise we can call this is what you call red cell indices is there. All otherwise we can consider the red blood cellular indices, otherwise the absolute indices. So these are the different synonyms for blood indices. So blood indices is itself considered the erythrocyte index. So when we get the report of a patient, in that there is a blood indices is there. There is not erythrocyte indices. Why I take this another term? Because we should know these other terms also, and these are helpful for the diagnosis of many diseases. We should know this. That's why I took this another term. But most probably it is reflected as a what you call it, that is a blood indices. So these are the some synonyms for a erythrocyte indices. For the diagnosis of erythrocyte indices, otherwise we can consider for the calculation of erythrocyte indices, we should need the three factors, that is the concentration of hemoglobin in the blood, RBC count, and packed cell volume. So on the basis of these three, we can calculate what is the blood indices, what is the number, what is the volume of blood indices. So with the help of that, we can diagnose the different type of anemia. So mainly, this blood indices is helpful in the diagnosis of exactly anemia. That means on the basis of this blood indices, at least we can do provisional diagnosis of anemia. Otherwise, we can consider the while we see the what you call the classification of anemia. In that, there is a morphological type of anemia is there, and on the basis of etiological factors, there is a different type of anemia. But at least on the basis of this blood indices, we come to know that what is the morphological changes takes place in the RBC, and on that basis, we come to know that which type of anemia is there. That is a morphological anemia is there. So that's why erythrocyte indices is helpful in the diagnosis of anemia. That's why it is also called as anemia indices, isn't it? So what it exactly includes, that is the blood indices exactly, otherwise erythrocyte indices exactly include MCV, MCSC, MCH, and what you call it, that is the color index is there. So color index, in older days, they have used the color index with the help of a percentage of hemoglobin and percentage of RBC. Most probably percentage hemoglobin we calculated in the grams, and RBC count is a cubic micron, isn't it? But we have to, first of all, we have to take in percentage, and after that there is a calculation we can do. But in olden days, practitioners are used this color index, that is the CI. But nowadays, with the help of this MCV, MCSA, and MCS, with the help of this, we can easily calculate the blood index. So what is exactly MCV, what is exactly MCH, MCSA, that we will discuss detail. So what is exactly MCV? That is a mean corpuscular volume. It is also called as a mean cell volume. Okay. So what is the exactly definition of that is a MCV? That means that we come to know that the exact size of RBC. That is we come to know that what is the average size of RBC. That means on the basis of this, we come to know that the size, that is normal, whether size of RBC is normal and abnormal, whether it is increased, whether it is decreased. So on that basis, that is the MCV, that is on that basis, we come to know that the volume, otherwise we can consider the average size of RBC. So along with that, it is reflected as we can consider it is a measure, unit of it, that is a cubic micron, and normal range of MCV is 80 to 100 cubic micron. And this is, I have mentioned, there is one calculation is there. With the help of that also, we can calculate the mean corpuscular volume. Next is the MCS, that is the mean corpuscular hemoglobin. So the name itself indicates what it shows. So that means the mean corpuscular hemoglobin, that means the amount of a hemoglobin present in a single RBC, isn't it? That means it indicates what is the concentration of a hemoglobin present in a RBC, isn't it? So with the help of that, we come to know that the color of a RBC. That means it indicates or it represents with the help of this what you call it, the unit, that is a picogram, and normal range of a MCS, that is a 27 to 32 picogram. So with the help of this, we can calculate. We come to know that whether cell is a normal, so that we can consider it the normochromic. Whether cell is the color of a cell is less, that means we can consider as a hypochromic. And if it is more red in color, that means RBC concentration is more in that, hemoglobin concentration is more in that. So with the help of, we come to know that cell is hyperchromic. So along with the help of this, we come to know that it's different types of anemia, isn't it? So next is that is the MCSC, that is the mean corpuscular hemoglobin concentration. So this MCSC is mainly helpful in the diagnosis of anemia. Obviously, MCV and MCH also helpful, but with the help of this MCSC, we exactly come to know that which type of morphological type of anemia is there. So, what is the exactly meaning of this mean corpuscular hemoglobin concentration? So, in that we come to know that the amount of hemoglobin present in RBC in relation to the volume of RBC. That means in that we come to know that the color of RBC along with that the size and shape of RBC. So it is very easy to diagnosis. It is always expressed in the percentage. The unit of this MCSC is a percentage, and normal it is a 30 to 38%, isn't it? So exactly in short, in one slide I have mentioned here what is the use of MCV, MCH, and MCSC. That is the MCV indicates size and shape of a red blood cell. MCH indicates the red blood cell, that is the color of a red blood cell, and MCSC indicates the size, shape, and color of a red blood cell. So you can put this in mind. Just only this slide, if you put in, if you keep in your mind, it is very easy to diagnose which type of anemia is there. So on the basis of this range, we come to know that which type of a different morphological type of anemia is there. If MCV is normal, that is the mean corpuscular volume is normal, that is we can consider as a, that is normocytic. That is normal indicate normal, cytic indicates cell, isn't it? So MCSC is normal, then cell, then anemia type is a normochromic, normocytic anemia. So most probably many time we consider that if cell is normal, if color of a cell is normal, then which type of anemia is there? So in that way, we have to concentrate. We have to concentrate on a RBC count. In that category, normocytic, normochromic anemia, cell is normal, color of a cell is normal, but there is a definitely number of RBC is less. That's why there is a reflection of anemia. That's why there is a manifestation of anemia is there. So this type of anemia you should consider as there is a normocytic, normochromic anemia. So whenever there is a MCV is a normal, but a MCSC is a decrease, so it can be considered as a normocytic hypochromic anemia. That means cell is normal, but the color of a cell is less. Color of a cell is less. That is hypochromic cell is there. So that's why there is a normocytic hypochromic anemia is there. Whenever there is a MCV increase, range of a MCV is increased. That is, if it is more than 100 cubic micron, then cell becomes big in size. That is a macrocytic. And MCSC is normal, then it is a normocytic, isn't it? So that means a type of anemia is a macrocytic and normocytic is there. But whenever there is a MCV is increased and along with that MCSC is decreased, that means the cell become macrocytic but hypochromic. That means the color is less but the cell size is big. Okay, so this can be observed in which type of disease that we will discuss later. Along with that, next category is whenever there is a MCV is decrease, that means cell becomes small in size. Okay, that is a micro. That is a differentiation. They call macrocytic and microcytic. Macro indicates big in size and micro indicates very small in size. So in that cases, you can consider it the microcytic cell is there. But if there is a MCSC is a normal, and that is you should consider the normocytic. It is most probably observed whenever there is a disease is very acute in stage. For example, rheumatic arthritis is there. When rheumatic arthritis is in acute stage, that time there is a cell is considered as a microcytic. Otherwise, sometimes normochromic cell is there. But once this is become chronic, then cells becomes macrocytic and hypochromic. So these are the changes can be observed into the bloodstream. So along with that, we come to know that the different type of anemia. So that is a morphological classification of anemia. With the help of this red blood cell indices. In this picture also you come to know that what is exactly appearance of a hypochrome, what is the normocytic cell is there, hypochrome cell is there. So on the basis of that we can conclude. So this is the main topic, that is how we clinically interpret there is a low MCV is there. So obviously on the basis of signs and symptoms of a patient, we have to correlate the investigations associated with the signs and symptoms. So obviously I have told already there is a low MCV. That means MCV indicates the size of a cell, size and shape of a cell. So in that there is a low MCV. That means you can consider that the RBC become very small in size. Okay. So most probably we come to know that we always know that there is a low MCV. That means definitely there is a iron deficiency anemia is there. Obviously there is a iron deficiency anemia, but other conditions are there. In that cases also sometimes there is a low MCV is there. We cannot directly jump on the on that there is only iron deficiency is there, and there is no other factors are responsible for that. But if you check the TI studies, you can consider the total iron binding capacity of a patient. Otherwise, serum ferritin if you check, serum iron if you check, there is a serum iron is normal, total iron bind capacity is normal, but even though patient has a low MCV. So which are the other diseases also responsible for the low MCV? That is the thalassemia is one of the common cause which is responsible for the low MCV. And along with that, there is sometimes anemia, which is seen in the chronic diseases. And if there is an inflammatory condition is there, a long-lasting inflammatory condition in the body, in that cases also there is a chances of a low MCV. So sometimes there is other factors. If patient is on long-term medications, so in that cases also there is a chances of a low MCV. So in that cases there is you can see there is a lead poisoning is there. If patient is is an anti-tuberculosis drug is there. If there is a bacteriostatic drug if patient takes, and along with that if there is a immunosuppressive drug is there. So in that cases also there is a chances of a low MCV. So for that purpose you have to take a good history of a patient. So you come to know that which is the main reason behind that cell becomes very small inside. That is what you call microcytic cell is there. So along with that, some other disease conditions are there. In that cases also there is a chances of a low MCV that I have mentioned here. That is the lupus is there, Crohn's disease is there. Otherwise, acute and chronic sideroblastic anemia is there, congenital sideroblastic anemia is there. Along with that, colorectal cancer, thalassemia, and rheumatoid arthritis. In that diseases also there is a chances of a low MCV, and which is a reflection of a microcytic cell is there. That means cell is very small. So on the basis of a range of what you call that is a microcytic cell, on the basis of a size of a cell, there is sometimes there is a different categorization of what you called mild microcytosis is there, moderate or marked or severe. So whenever there is a hemoglobin count is less than 6 gram is there, in that cases you can consider is a severe microcytosis is there. So it is most probably observed in case of the beta thalassemia major, isn't it? And you can consider it is a very serious type of a thalassemia is there. It is exactly sign of a serious thalassemia. In that cases, you can come to know that there is a severe microcytosis is there, and in that there is a size of a cell is sometimes less than 55 cubic micron. Whenever there is a marked microcytosis, if you see, so in that cases, the range is in between 55 to 75. So it is most probably seen in the, commonly we can observe in adults, in children also. That is iron deficiency anemia. In that you come to know that is a moderate, if you see there is a moderate type of anemia, that is a 7 to 8 gram hemoglobin is there. So in that cases there is a, we can see there is a marked microcytosis is there. Whenever there is a moderate microcytosis is there, so hemoglobin range, that is, it should be below the 9 gram. And along with that, the range of MCV is what you call it, 55 what you call it, 55 to 75. So in that cases also we can see on the basis of that we can categorize the different microcytosis is there. So whenever there is a mild microcytosis is there, so there is a 75 to 80 filtoliter, otherwise cubic micron range of a MCV is there, and it is most probably seen in case of the patient if there is a heavy menstrual bleeding is there. So in that cases there is a chances of loss of excessive loss of blood from the body. If there is a immediately what you call a road accident is there, and in that cases there is a loss of blood is there from the body. So in that cases there is a mild microcytosis can be observed into the patient. It doesn't mean that it is exactly anemia. So these are the sometimes there is a emergency conditions are there, that is a loss of blood from the body due to the accident. Okay. So in that cases, whenever there is a loss of blood from the body, the plasma plays important role in that. There is a matchup. Sometimes there is a matchup of a body. That means the body has to continue the erythropoiesis condition. Erythropoiesis generation should be continuation. So with the help of that, plasma takes important role in that cases. So plasma plays important role for the what you call for the you can see sometimes patient has a came along with what you call edema all over the body because what it happens, there is obviously there is a loss of blood from the body, but because of the excess plasma is there, and because of that there is a edema can be observed into the patient. So that is due to the hemodilution. If you see, it is also seen in case of the pregnant woman also. You observe that patient is taking iron medicine, patient is taking folic acid, vitamin B12. So even though there is a edema is there, even though there is a pedal edema is there, sometimes facial edema is there. So why it is happened? That is a physiological changes taking place in the pregnant woman. That is a hemodilation. So in that cases, there is anemia can be observed due to the hemodilation. So this can be same. That is a mild microcytosis can be observed, can be seen due to the hemodilution. So these are the categorization we can done on the basis of a range of a MCV. The next, most probably MCV observe into the iron deficiency anemia. But for the iron deficiency anemia, what is the exactly reason which is behind that? We should take proper history of a patient, and what is exactly we always see ask to the patient whether there is a proper iron intake in your diet or not. It doesn't mean that there is which will be responsible for the iron deficiency anemia. There is other factors are also there is also responsible for that. So for that purpose, we have to take proper history of a patient. So if person is frequently there is a blood donation is there. If there is any gastrointestinal disease is there, inflammatory disorders is there, you have to ask to the patient, because in case of the hyperacidity is there, patient has a what you call more gastric irritation is there, and due to that there is iron absorption is very less in that cases. So for that purpose, you have to ask the detailed history of a patient. So on the basis of that history, and on the basis of their clinical signs and symptoms, and along with on the basis of this investigation, we come to know that we can jump to the final conclusion of a disease. So along with that, you should ask if there is a female patient is there, you should ask whether there is a heavy menstruation is there. If patient is a pure vegetarian is there, this is the main cause, isn't it? Pure vegetarian, and if there is a very less intake of iron into the food, isn't it? So because of these chances, because of this, there is a chances of iron deficiency anemia. That means that there is a deficiency of iron in the blood. So due to that, there is a manifestation of anemia. That's why it is called as the iron deficiency anemia. So what exactly iron plays important role in our body? So iron is mainly responsible for the formation of a hemoglobin, isn't it? And whenever there is iron less is there, that means the hemoglobin is not properly formed. And whenever there is a hemoglobin not properly formed, the exactly red color to this cell is not proper. That means it will not get proper, isn't it? Because of that, cell become very pale, cell become very small in size due to the absence of hemoglobin into the RBC. So this is because of that, without enough iron in the body, the red blood cell cannot make hemoglobin, and this result in the smaller red blood cell size, isn't it? So that means iron deficiency is the main cause which is responsible for the small size of a cell, that is a microcytic cell. Another cause for the, along with that, clinically how you interpret. So in that cases, patient has this type of symptoms. You can see there is a poor concentration is there. There is a feeling of a feeling of a weakness. There is we can see there is a fatigueness is there. There is a brittle nails are there. There's a paleness of skin, severe headache is there. Patient has a chest pain. Patient has a palpitation is there. Along with that, there is a, if student is in case of the student, there is a poor concentration is there. Patient is not, sorry, students are not able to concentrate on study. So this might be observed. This might be seen because of the deficiency of iron. So, and with the help of this, we can see. So, what are the different other causes which are also responsible for the small RBC? Sorry, small RBC, that is a microcytic. That is the main in case of the rheumatoid arthritis. So, what happened in case of the rheumatoid arthritis? Obviously, it is an autoimmune disease. It is a non-suppurative, but it is an inflammatory disease, isn't it? So, in that cases, there is an inflammation to the joint. So, in that cases, what happened? The some inflamed tissue, the inflamed tissue which is present at the joint, sorry, these inflamed tissue are responsible for the releasing some proteins, and these proteins are affect on our body, and because of body, there is a body is a not there is a loss of ability of a body to use iron, which is coming from the food, isn't it? So body is not able to use that iron, and because of that, there is a production of red blood cell will get a hamper. If you see the report, CBC report of a rheumatoid arthritic patient, there is obviously you can see there is a WBC count is more, isn't it? There is a hemoglobin range is always less. There is a, you can consider there is a RBC count is very less. There is, if there is acute stage is there, neutrophil count is what you call very high, but it is but if you see that it is what you call chronic stage is there, there is a lymphocyte count is definitely increased. WBC count is very high in that cases, but definitely there is a RBC count is very less. This is due to the proteins which is coming from the inflamed tissues. For example, cytokines are there, which are mainly affect on a body's ability to use the iron which is coming from the food, and because of that there is a chances of a less MCV, isn't it? So in that cases, what happens? Along with that, if patient is on medication, so in that cases, what happened? There is a chronic irritation to the gastric mucosa, and sometimes there is a bleeding from that mucosal area, and because of that, there is a blood loss from the body, and due to that, there is there is a chances of a less MCV. That is, you can consider there is a microcytic cell is there, isn't it? In case of the thalassemia, we all come to know that this thalassemia is a inherited disease, and there is a defect in the hemoglobin. If you see the hemoglobinopathy, in that you come to know that there is a defect in the structural defect in the hemoglobin. There is two polypeptide chains are there, alpha and beta chains are there, and there is a defect in the alpha chains, otherwise beta chains, and which will be responsible for the thalassemia alpha and thalassemia beta. That is a minor and major. So there is a mainly defective takes place into the polypeptide chains, isn't it? That means there is a disruption, disrupted. You can consider there is a how to body produce the hemoglobin and the healthy red blood cells. So there is a defective mechanism takes place into the hemoglobin. That's why there is a, you can see the cell becomes very small in size. So this can be observed into the patient. So this is related to the low MCV, isn't it? But whenever there is a high MCV is there, that means the cell becomes a macrocytic cell is there. Till now we have discussed the microcytic, small cell is there. But now we will discuss the macrocytic. That means when cell becomes big in size. So there is many reasons are there. Vitamin B12 deficiency is there. Some condition is there, but due to some diseases also, there's a chances of what you call there is a high MCV is there. That means the cell becomes macrocytic. So there is a vitamin B12 deficiency is there, folate deficiency is there. Even there is a carbon monoxide concentration poisoning is there. Otherwise, if patient is on chemotherapy, patient is a known case of the alcoholism. Whenever there is a hemolytic anemia is there, whenever there is a hypoxia is there, that means less concentration of oxygen into the blood, and hypothyroidism is there. And in case of the liver diseases, in that cases, definitely there is a high MCV is there. How it will be, that we will discuss. So see, the folic acid and vitamin B12 is there in the if you take in the body from the food, it will be mainly responsible for the normal maturation of RBC, isn't it? That means there is a generation of RBC. There is a erythropoiesis system goes normally if there is a vitamin B12 and folic acid properly into the body. But whenever there is a vitamin B12 deficiency, along with that folic acid deficiency is there, there is a defective in the erythropoiesis. That is a dysplastic in the erythropoiesis. That means this process, that is erythropoiesis, that means the generation of RBC. ठीक है, RBC नया होना चालू हो जाता है. But due to the deficiency of this, there is a immature cell can be formed. There is a ineffective, otherwise you can consider the dysplastic erythropoiesis can be seen. And due to that, there is a RBC proliferation. Along with that, there is a maturation result in the large erythroblast, isn't it? And why it is happened? And along with that, there is a synchronization of nucleus and cytoplasm will get changed. Okay, cytoplasm will become very small and nucleus become very bigger. So in that cases, there is a synchronization can be seen. Because of that, there is a you can see the cell becomes very big inside, and it is happened. It is seen due to the defect in the DNA synthesis, and which will be responsible for the cellular proliferation. And due to that, there is a maturation, cellular proliferation along with the maturation. There is a disturbance in that, and because of that, there is a cell becomes big inside. You can see in this picture also there is a what is a normal cell is there and what is a big cell is there. So with the help of that, we come to know that these are the reasons, these are the deficiency which is also responsible for the high MCV. Along with that, liver diseases and chronic alcoholism is also responsible for the macrocytic cell. In case of the liver disease, we come to know that whenever there is liver disease is there, so diseased liver is responsible for the synthesis of liver produce some plasma, and that plasma leads to reduce the serum level of several blood clotting factors. And because of that, there is an excess cell membrane is there. And we all of you know that liver plays important role in the iron homeostasis. And due to that, this disease condition, there is a normal function of liver will get hampered, and due to that, there is an excess RBC membrane will take place, and this is the chances responsible for the macrocytic. That means cell becomes very big in size. And patient is on there is excessive consumption of alcohol is there, which will be responsible for the obviously there is responsible for the poor nutrition, and due to that there is a poor absorption of vitamin B12 in the digestive tract, and sometimes there is a direct what you call effect of toxicity of what you call alcohol on the bone marrow, isn't it? So that will be also responsible for the defect in the cell, and because of that, there is a cell becomes big inside. That is itself we consider as there is a macrocytic cell is there, isn't it? Sometimes in case of the hypothyroidism, there is a chances of a big size cell. Why it is? Because thyroid is mainly responsible for the erythropoietin. That means the hormone is released, stimulate to the production of erythropoietin, and thyroid hormone is responsible for the erythropoietin. This erythropoietin is what you call it, stimulate to the red bone marrow to stimulate what you call RBC. But there is a less thyroid, that is in case of the hypothyroidism, there is a less thyroid hormones which are not able to produce erythropoietin. That means there is a less stimulation to the red bone marrow, and due to that there is a less RBC production is there. And whatever remaining RBC is there is a workload on that remaining RBC will get increased. ठीक है, अगर 10 का काम अगर 5 लोग कर रहे हैं, that means there is a strainful work on that 5 people, isn't it? So in the similar way, the strainful work on that remaining RBC due to that deficiency of erythropoietin, because erythropoietin is not responsible for the stimulate to the red bone marrow to produce new RBCs. So whatever remaining RBCs is there, weak RBC is there, the older RBC is there. So in that cases, what happened? The workload on that particular RBC will get increase, and due to that, there is the chances of a size of a cell will get increased, isn't it? And due to that, there is a cell becomes a macrocytic cell is there. So this is related to the till now we have discussed that is a high MCV is there. That means what are the reason behind the macrocytic? That means cell becomes big in size. So next we jump to the low MCF. That means it is till now we have discussed the size of a cell. Now we will discuss the color of a cell. That is the chrome itself indicate color of a cell. That is the chrome is a color, isn't it? So that means the amount of hemoglobin present in that particular cell, isn't it? On that basis, we come to know that whether cell is a hypochromic, whether cell is a normochromic, whether cell is a hyperchromic, isn't it? So obviously, it is seen in case of the iron deficiency anemia. There is a low MCH is there. That means what you call there is a very pale cell is there. So most probably it is seen. Obviously, there is a very low diet, very low iron diet is there. If there is a major surgery is there, and if there is a trauma, otherwise there is a blood loss. For example, in case of the heavy menstruation is there. So in that cases, body absorbs a small amount of iron that is available in the diet, which leads to low hemoglobin. And I have already told that iron plays important role in the production of a hemoglobin, and due to that, there is a chances of a low MCS that indicates there is a less iron, less hemoglobin into the cell. Due to that, the color of a cell is pale, because the hemoglobin, due to the presence of a hemoglobin, there is a red color to the RBC, isn't it? But there is a less hemoglobin into the RBC because due to the less iron. So because of that, there is a cell is a pale. That is, you should consider that there is a hypochromic cell is there. You can see, I have in the picture, I have shown that there is a pale hemoglobin, a pale cell is there. That is itself considered as a hypochromic cell is there. So along with that, in case of the thalassemia, so obviously I have told already that it is an inherited disease, and in that case there is a defect in the hemoglobin itself. That means the production of a hemoglobin is limited, isn't it? And due to that, there is in the bloodstream there is a less RBCs which is circulated in the bloodstream. In that there is a hemoglobin concentration is very less in that bloodstream, and due to that the cell becomes very pale. So this is also reason which is responsible for the hypochromic, isn't it? In celiac disease also, in celiac disease, you all of you know that it is protein and gluten, which is very rich in wheat. हम चपाती बना के खाते हैं ना, तो very rich in that. So there is a malabsorption. It is a celiac disease is a malabsorption. So in that there is a malabsorption of a protein. The protein is not absorbed properly into the body. So due to that, there is you can see there is a what you call absorption of iron, because for the iron polypeptide, for the formation of polypeptide chains in the what you call in the hemoglobin, we need protein. But due to this celiac disease, there is a poor absorption of a protein. There is a malabsorption of a protein. So there is iron is not good absorbed into the body, and due to that there is a low MCH is there. Along with that, if there is a very less vitamin C in the diet, because vitamin C is responsible for the absorption of iron in the intestine. If you take the iron diet, but there is a very less vitamin C in the diet, there is a no use. It will go out from the body to the stool itself. Okay. So we have to take vitamin C along with that iron diet also, because the vitamin C plays important role in the absorption of iron. But if there is a vitamin C is not absorbed properly, iron is not absorbed properly in case of the celiac diseases, due to that there is a low MCH is there and cell becomes hypochromic. Along with that, if there is a chronic bleeding is there, if there is any gastrointestinal bleeding is there, gastrointestinal ulcer is there, if there is a more gastrointestinal irritation is there, ulcer formation is there. So in that cases, there is a chances of store of iron gradually deplete. It will get decrease, and due to that, there is a resulting into the what you call very less hemoglobin into the RBC, and due to that, there is a low MCH is there. So these are the reason. Along with that, what are the symptoms you can observe whenever there is a low MCH there? There is a shortness of breathing, chest pain is there. There is a fast heartbeat. That means you can consider the palpitation is there. There is a feeling of weakness. There is a very pale, otherwise yellowish skin is there, and headache is there. So these are the some symptoms you can observe whenever there is a low MCH is there. Now we'll discuss whenever there is a high MCH. So high MCH is related to the hyperchromic. But in case of the anemia, hyperchromic cell is a very rare, isn't it? Because a single cell becomes hyperchromic, we cannot count it. Okay? But sometimes it can be seen in case of the megaloblastic anemia, that is found, that it can be seen due to the vitamin B12 deficiency. Hello, Vandana ma'am. If there is time now, I can continue now.
Yes, madam.
Okay. Yes. So in case of the MCV, what you call MCH, high MCH, that means it is hypochromic cell is there. So in that cases, MCH is more than 34 grams. That means high MCV cell indicate hyperchromic. So that is most probably seen in case of the microcytic anemia. But in case of the anemia, what happened? There is a less RBC is there and higher concentration of hemoglobin is there. ठीक है, तो जितने लेस आरबीसी है उसमें क्या रहेगा कि हीमोग्लोबिन तो जाके उसमें क्या रहेगा, एफिनेट हो जाएगा, अट्रैक्ट टुवर्ड्स द आरबीसी. So there is a less number of RBC, but there is a higher concentration of hemoglobin is there, and due to that there is a cell membrane becomes big in size, isn't it? And along with that cell becomes over colored, that is a more red color is there, that is a hyperchromic is there. So that is due to the but size of a cell is larger than the normal, and each RBC also contains more hemoglobin, and because of that there is a hypochromic cell we can consider, but it is a very rare, isn't it? But sometimes it can be seen in case of the megaloblastic anemia. So this is also reason. Along with that, another causes also responsible for the hyperchromic cell, that is this function of a thyroid hormone. Along with that, that is one genetic disorder, that is spherocytosis is there. Whenever there is excessive use of estrogenic drug, some females are take contraceptive. So in that cases also there is a chances of a high MCH is there. Along with that, if there is a continuous microbial infection is there, along with that patient is to suffer from leukemia, that is itself we can consider the blood cancer is there. And if patient is on a chemotherapy, long lasting chemotherapy, which will be responsible for the same, isn't it? So which are the symptoms we can observe into the patient whenever there is a what you call whenever there is a high MCH is there. So there is a, you come to know that there is a tingling sensation in the hand and feet. You can see there is a mental symptoms also observed into the patient. There is a depression is there, confusion is there, isn't it? So in that cases also along with that we come to know that there is a bloating of gas, nausea, vomiting. There is a smooth or sensitive tongue tongue become very smooth and sensitive. There is a decreased appetite, diarrhea, and irritability. So these are the common symptoms can be observed into the patient. So this is related to the high, but whenever there is a low MCSP is there, so in that cases you come to know that whenever there is a low MCSP, that means there is a, obviously it is the same in the several type of anemia. We come to know that the what you call different type of diseases, along with that morphological type of anemia, but some etiological factors on the basis of the anemia, which is classified on the basis of etiological factor. In that cases also we come to know that there is a low MCSC is there, and with the help of that also we can diagnose. So in that case there is a hemolytic anemia is there, a plastic anemia is there. In case of the pernicious anemia, iron deficiency anemia, definitely in that cases there is a low MCSC is there, isn't it? So obviously iron deficiency anemia, there is a low iron is there. Due to that, there is a hemoglobin is very low, and due to the low hemoglobin, there is a less color to the RBC, and there is a size also, and color of RBC will get decreased. So this can be seen. In the case of the pernicious anemia, there is a vitamin B12 deficiency is there. In pernicious anemia, manifests due to the vitamin B12, and due to that, there is a chances of maturation of RBC, and due to that there is a cell becomes hypochromic. In case of the aplastic anemia, there is a total aplastic is there. That means there is a total cytopenia. What you call, there is a pancytopenia is there. That means RBC count is less, WBC count is there. There is a platelet count is less. That means the foreign element of a blood is completely lost, completely less is there, and it is manifest due to the defective in the bone marrow, isn't it? And in that case, there is a definitely low MCSC is there. In case of the hemolytic anemia, obviously there is a hemolytic, that means there is a excessive RBC destructions are there. So there are many cases are there. If there is a enlarged spleen is there, thalassemia is there, any hemolysis infection in the urinary tract is there, vasculitis is there. So in that cases, there is a chances of what you call defect in the formation of a red blood cell, and there is a less hemoglobin is there, and due to that there is a hemolytic anemia can be observed into the patient, and definitely in that cases there is a low MCSC is there. Along with that, whenever there is a red bone marrow defect is there, gastrointestinal tumor is there, inflammatory disease is there, most probably when patient is on a chemotherapy, so there is a directly effect on the production of RBC, and which is responsible for the what you call anemia. And in case of the kidney, whenever there is a kidney disorders there, definitely if you see the CBC report of a patient, definitely there is a RBC count is very less, because the kidney takes part in the releasing of a hormone, that is erythropoietin. That erythropoietin is responsible for the stimulate to the red bone marrow to produce red blood cells. So that will get affect whenever there is a kidney diseases are there, and due to that there is a chances of a low MCSC. So in this picture you can see whenever there is a low MCSC is there, the cell is very small. This color of the cell is very pale. In that cases, these are the symptoms can be observed into the patient. That is a weakness and fatigueness is there, or fatigueness is there, chest pain is there. Along with that, patient has a lack of concentration is there, dizziness, headache, cold hand is there, or cold feet is there, fast irregular heartbeat is there, that is a palpitation you can see, most probably pale skin and gums is there, and shortness of breathing. So these are the all symptoms. Along with that the investigation, we come to know that which type of anemia is there and what is the reason behind that, isn't it? Whenever there is a high MCSC is there, the clinical interpretation is there when a high MCSC. So these are the some diseases, that is autoimmunohemolytic. In case of the severe burn is there, overactive of thyroid is there, liver diseases are there, and hereditary spherocytosis is there. So in that cases, there is a high MCSC is there. So what happened exactly in that cases? If there is a autoimmunohemolytic disease is there, So obviously, we all of you know that autoimmunohemolytic, autoimmune itself indicate autoimmuno, that our immunity system will get suppressed, and our own cells are started to attack on our own cells. That means हमारे ही soldiers, जो WBC are called, that our own soldiers, our own defensive cells are attack on our own bodily cells. That means the antibodies, whatever formed automatically, that will start to break to the otherwise rupture to the red blood cell, isn't it? And due to that, there is a chances of high MCSC because of more RBCs are destructed, and whatever remaining RBCs which is present into the body, the workload on that particular RBC will increase. And due to that, there is sometimes there is chances of a high MCS. That means color and size of a cell will get increased. This is the major reason. Whenever there is a hereditary spherocytosis is there, cell becomes spherical in shape. It is inherited disease which is passes from a parent to the child, and in that cases directly attack on the RBC membrane, isn't it? So whenever there is you can see there is a defective in the protein. On the if you see on the cytoskeleton inside the cell, there is a defective proteins are there, and there is a genetic condition that attacks red cell membrane, making it for destruction. That means cell becomes very fragile. Easily it will get break due to there is a spherical in shape. Due to there is a what you call defect in the protein. That because of that there is a what you call cell will easily break. So that can be observed in case of the hereditary spherocytosis. Along with that, in case of the severe burn cases, there is obviously in that cases there is hemolytic anemia can be observed, and due to that there is a high MCS can be observed. In the case of the liver cell, definitely there is you can see there is a storage and process of a hemoglobin can be observed into the liver, but due to that condition, sometimes there is a hypochromic, otherwise microcytic or macrocytic anemia can be observed. So that is due to this. So what are the symptoms can be observed whenever there is hemolytic anemia is there? Along with that, which include the symptoms like jaundice is there, weakness, abdominal discomfortness is there, paleness, rapid heartbeat is there, fainting, fatigueness, enlarged spleen. So these are the all symptoms can be observed. If you remember, if you are not forget, first on second and third slide I have given the symptoms of a patient, but I have not told what are the symptoms can be, what is the diagnosis of that related to that symptoms. But now I am coming to the last slide. Most probably you come to know that the symptoms related to the not related to exactly heart, that is all symptoms related to the anemia. Which type of anemia is there? On the basis of there are signs symptoms, you come to know that, isn't it? So along with that, if there is a microcytic anemia is there, which is similar to the hemolytic anemia, but along with that, these are the other symptoms are also seen in the patient, but along with that, there is a weight loss of appetite is there is a brittle hair, nail is there, diarrhea is there, even there is a memory power also loss. It is more probably seen in case of the children, along with that in what you call it, in adults also. It is most probably seen, isn't it? So these are the liver diseases, which is the symptoms related to the anemia, that is the nausea, vomiting, and upper right abdominal pain is there. So obviously related to that particular disease, but the symptoms which is related to the anemia, that we have to also observe. That means the term is that is anemia in the chronic diseases, isn't it? These are the all diseases which are responsible for the manifestation of anemia. That means in that cases, anemia is itself considered as a complication of these all diseases. It reflects as a complication in that diseases. So we have to concentrate on these also. So whenever there is a high MCSC is there, that in case of the overactive thyroid is there. So in that cases, that the sweating is there, excessive hunger is there, fatigueness is there, restlessness is there, palpitation, weight loss, and weakness is there. So that means we have to clinically interpret on the basis of their signs and symptoms, along with their whatever reports, on the basis of their findings in the reports. So lastly, on the basis of this MCV, MCH, and MCSC, we come to know that these types of anemia, that is a normocytic, normochromic anemia is there, microcytic hypochromic anemia is there, and macrocytic normochromic anemia is there. So these are these types of anemia we can diagnose on the basis of these blood indices, but with the help of other investigation. That means you can advise the patient vitamin B12, iron, what you call it, serum iron level, otherwise the serum ferritin level, total iron binding capacity. So with the help of that also, we come to know that exactly that what you call final diagnosis. That means confirmation of a disease. But at least on the basis of this blood indices, we come to know that at least we can do the provisional diagnosis of a disease. So with the help of this, it will help a lot for the diagnosis of a different type of anemia. So I have given some list of different type of anemia. Otherwise, along with that, name of the diseases. So these are the diseases in that this type of morphological type of anemia can be observed. So with the help of that, we come to know that which type of treatment. Otherwise, because it doesn't happen, sometimes patient come to us with complaints of anemia. और सभी को ही आयरन ही देना रहता है, आयरन टैबलेट ही देना रहता है. It is not like that, isn't it? We have to sometimes with folic acid, we have to give sometimes vitamin B12 tablets, multivitamin tablets we have to give. Sometimes we have to give iron only. So in Ayurveda also, the all type the treatment of Pandu is not same. Treatment for Vatach Pandu is different, Pittach Pandu is different, Kaphach is different. Even in case of Mrudbhakshanjana Pandu, Sannipatach Pandu, there is all treatment of other types of anemia of Pandu is respectively alag hai. We cannot give same treatment to all types of what you call anemia, but it happens many times. It happens we are giving same treatment to all types of disease. That's why in globally also, we if you see on net also, there is a prevalence rate of anemia is very high because there is inaccurate diagnosis. We don't know which type of anemia is there. Just on the basis of a hemoglobin range, just on the basis of a quantitative analysis, we have given some medication to the patient, but for 15 days, for 1 month. But after again 2 to 3 months, the patient again visit to your clinic and say with the same complaints, and sometimes it will be responsible for the complications also. Other disease will be also manifest due to this if you not treated anemia properly. Okay, so this is my main intention. We have to first diagnose properly which another type of anemia is there, and anemia is manifest along with some other diseases. Otherwise, it manifests lonely. Which are the positive factors behind that? Otherwise, we can see which are the associated symptoms, associated positive factors are responsible for that. So, all over that, we come to know that which type of exact type of anemia is there and which type of treatment we have to advise the patient. So, along with that, I have given many list of diseases and which type of anemia can be observed in that cases. On the basis of these blood indices, we can diagnose easily. So there is no need to recall all these things. Just I have mentioned here, and I have already given the pictures. Normal cell how it look and macrocytic cell how it look. When it becomes in big size, when it becomes in a small size, I have mentioned here. And these are this slide. There is a peripheral blood smear when we take. So in that we come to know that what is a normocytic cell, what is a normochromic cell is there. When cell becomes microcytic, hypochromic, how it see. in case of the microcytic, in case of the macrocytic, how it observe, that I have given. So last part, that is the come to the conclusion part. Obviously there is a RBC indices, that is erythrocyte indices, measure the size, shape, and physical characteristic of a RBC, isn't it? That means we come to know that on the basis of erythrocyte, we come to know that the size, shape of a cell, isn't it? Along with that, this indices also helpful in the causes of anemia, that we have discussed all these things. Okay, so that causes may be related to the food, may be related to the disease. Any type of a disease is also responsible for the variation into the blood indices, isn't it? So with the help of this RBC indices, we come to know that to diagnose the causes of a different type of anemia, isn't it? Red blood cell also helpful in the classify the anemia on the basis of their morphology, on the basis of their etiological factors. We come to know that which type of anemia is there, isn't it? On the basis of the MCV, come to know that the size of a cell, whenever there is a size of a cell is normal, we can consider it is a normocytic cell. Whenever size of a cell is a decrease, it is considered a microcytic cell. Whenever size of a cell is increased, it is considered a macrocytic cell. So we come to know that on the basis of a MCV is there. On the basis of a MCS, we come to know that whenever there is a normal hemoglobin into that particular cell is there, that means and cell has a normal color, that means we can consider it is a normochromic cell. But whenever there is a color of a cell is decreased, that means we should consider that it is a hypochromic cell, and whenever it will get increased, you should consider the hyperchromic cell, isn't it? And on the basis of a MCST, we come to know that the color of a cell along with that the size and shape of the cell. Whenever there is a normal concentration of a hemoglobin and a normal cell is there, that means we have to consider as there is a normochromic or normocytic anemia is there. But whenever there is a cell with a normal concentration of a hemoglobin is there, definitely we should consider as there is a hypochromic cell, isn't it? And whenever there is a hemoglobin concentration is more but cell is normal, otherwise decrease or increase, on that basis we should consider as it is a hyperchromic, hypochromic, macrocytic, microcytic. Okay? So this we all come to know that on the basis of a MCSC. So in this way I have end my topic here, and hope it will be, I have given, actually it is a very vast and very big topic, but I have chosen in small concept, and what is the exactly reason behind that, I have chosen on the basis of that I made all the slides. So hope it will be easy to all understand, and student will be benefited with this. Okay, thank you. These are some references. Thank you. Thank you, ma'am. It is over from my side.
Okay. Thank you, madam, for giving such a knowledge. I request to all participants and students, if you have any question, may ask you. कुछ query है, student? If you have any question, किसी को कुछ नहीं मैडम. Thank you, madam, for.
They are waiting for lunch. It is lunch time, na?
Yeah. Thank you, madam. Today's session is very informative and knowledgeable, madam. Thank you, madam.
Okay, thank you. Thank you so much. Once again, thank you so much for this opportunity, madam. Thank you.
Okay, thank you, madam. Okay, bye.
Okay. Yeah, shall I exit, ma'am?
Yeah, exit, madam.
Okay, okay, ma'am. Thank you.
Okay, thank you, madam.
Okay, thank you so much.
तो डायरेक्ट उनसे बात नहीं होता है.